Hi, everyone. My name is Ian Cross. I'm the digital executive producer here at News 5 Cleveland. I'm speaking today with Alex Sheen. He's the founder of Because I Said I Would, which is a nonprofit organization and a social movement started right here in the Cleveland area, in Rocky River specifically. And we're talking today a little bit about a public service announcement that he put out on his various social media channels earlier this week and kind of the impact that it's had. Thank you so much for joining us, Alex. Can you tell me a little bit about Because I Said I Would?
Yeah, this organization is about the thought of individual accountability, right? Concepts like honesty, self-control, accountability. How does our character grow, develop as people? Our charity does character education programming in schools, prisons, juvenile detention centers, centering around this thought of keeping a promise. And I think that's a really important concept, individual responsibility right now during the pandemic.
Great, yeah, and you're doing a lot to support people who are impacted by the pandemic, which we'll get to in a little bit. Sorry, oh, that's me. I'm sorry. But first, I wanted to play a little bit of that PSA. So let me just pull this up on our screen here, and you can find it on his website. It is becauseisaidiwould.org.
Yeah, becauseisaidiwould.org/Thanksgiving.
Cool, and let's go ahead and play a little bit of this now.
We're going to sit behind a camera, behind a well-appointed desk. They're going to take off their mask like I just did. They're going to tell you that we're entering a new phase.
At the most crucial phase, all-time record,
Growing at an alarming rate.
The likes of which we have never seen.
It's serious.
They're going to warn you about multi-household gatherings.
Cancel the happy hours.
Dinner parties.
They're going to dispel some misunderstandings.
Testing has not even doubled. Cases have gone up almost 4 times.
These are facts.
The facts are the facts.
They're going to thank healthcare workers, and they're going to call you by your team name.
My fellow Utahns.
Michiganders.
Kansans. Fellow Ohioans.
My fellow Alaskans.
Kentuckians.
After hearing the same thing over and over again, don't we just want our politicians to cut to the chase, right? Be honest with us? We've said this in years past. We just want politicians to be honest. Well, here's the thing about honesty. Everybody appreciates honesty until you're honest with them. You want honesty? How about this? Did you know that healthcare workers can just quit? They can just quit. If the job gets too overwhelming, they can quit and go home. They're not obligated to save our lives.
Well, really, and the message kind of only gets more emotional and impassioned from there. But, let me ask you, why did you decide to put out this PSA?
I think right now is a time for us to all look at this moment as one of personal sacrifice. In school, I was taught that we all have a role to play in this nation, that my birthright of freedom had a cost, that coming together, sacrificing for a greater good was part of being an American citizen. And I know that it shouldn't be that all the time, but there's going to be peaks and valleys in our history that require this togetherness. And that's what I think we need right now. We're at a point where 1 in every 378 Americans were diagnosed with COVID-19 in the last week, only the last week alone. And if we head into Thanksgiving without caution, warning, without changing our plans, it's going to overwhelm our hospital system. It's not just about those who have COVID-19. It's about people who have any kind of condition, any kind of screening, any kind of need, like a heart attack. It's about the protection of healthcare overall and not this single issue.
Absolutely. Absolutely. So, since that PSA has come out, what has the reaction been? Can you tell us, how far it's spread? Kind of any surprising people that have, kind of passed it along that you didn't expect?
Yeah, I think that, a million or millions of people have seen it in the last 24 hours, which was a shock for me to wake up to, with my phone blowing up, doing whatever it does. But, that's not really the important part. The more important part is the feedback from healthcare workers themselves. And that's a range of people. There was a comment on there from an individual who literally sanitizes the inside of ambulances that may be COVID positive. And he literally keeps the count. He's at like 359 ambulances will be the next one that he cleans, and he keeps account of that because he's trying to keep himself motivated, knowing that that type of work is going to keep people safe. But you will hear and see in the log of all these comments under that video, people who aren't saying that they're on the edge of quitting. There's plenty of those type of comments from ICU nurses in Missouri and other states. But there are people who are saying, I have already quit. I quit a long time ago. Wow. And that is part of the challenge. We can stack the supplies to the ceiling with pharmaceuticals, hospital beds, and capacity, but human beings still have to take care of us. And that in some ways is still optional. If they get overwhelmed, just imagine you at your job. If you get burned out, you will quit. And these are very serious circumstances right now. We need their support and help. And we got to do our part to keep the system together.
And for the record, I am not there yet. Had some days were both, but and that's absolutely kind of really cuts to the core of what we're experiencing right now with rising hospitalizations. I mean, you can only imagine, the kind of pressure and the kind of just daily burnout that some of these healthcare workers are experiencing. Now, your organization obviously has national reach, as did this PSA, but you are a proud Ohioan, which you were very upfront about in the video. Has there been any kind of reaction from Ohio specifically, or
no? Absolutely. I was born in Toledo, raised in Columbus, educated at Ohio University. I live in Cuyahoga County, and I'm a proud Ohioan. I think that as a state, we need to all do our part. And seeing the comments roll in from folks who are making the right decisions, making compromises, still living their lives as best we can in this scenario, but realizing that we've got to do our part as Buckeyes. But the calling us by the same name type of language, the camaraderie that we're trying to build, I guess that's important. But at the end of the day, these kind words aren't going to mean much unless we act. That's the most important thing. That's what, if we are so much of a team, so much of a state, then we've got to work together on this, and we've got to do each our own part in fighting this disease. And to your point earlier, our hospital systems aren't past capacity. That is true for Ohio, but that is not true for other states. In North Dakota, they have reached 100% hospital capacity. And the way this disease lags, we aren't quite sure actually where Ohio is going to be at. Some of those who have already contracted this disease and don't know it yet will impact our hospital system soon. And so the point of no return is hard to measure. And that's why we all have to do our part. That's why we all have to act sooner than later. Absolutely.
Can you tell me some of the other things the organization has done and is currently doing to assist those impacted by COVID-19?
Because I Said I Would has run one of the largest volunteer face mask sewing operations in the entire state of Ohio, with over 270 volunteers sewing over 20,000 face masks. But we've turned our energy towards other parts of the pandemic that are really affecting this state. We actually have an unemployment transition program, a leadership development program open right now, an 8-week program that if you have lost your job in the pandemic, go to becauseisaidiwould.org/unemployment, sign up. We have scholarships available, paid for by our donors. And the capstone project to this series of leadership workshops is to actually make a promise to help somebody else who has lost a loved one to COVID-19 itself. We are helping pay funeral costs and a number of other memorial services to help all sides of this equation. We understand this is a very complex issue with many ramifications. And so it's about prevention. It's about helping the hospital workers, but it's also about helping those who have lost their livelihoods too. Balancing that is a difficult situation, but we want to do our part as a nonprofit.
That's great, Alex. Well, I think it's fantastic, everything that you guys have been doing. People who see this video, who read this story, they may be looking for ways that they can help. And, obviously, Cuyahoga County and the city of Cleveland literally just a few minutes ago went into a stay-at-home advisory, not an order, but an advisory. And I'm sure many people are wondering, how can they help? How can they even help your group, while staying at home, while staying safe? And what are some ways that they can assist?
Sure. We would love the support of professional volunteers. If you email us, hr@becauseisaidiwould.org, we'd love your help. We need help finding families to help. We need help finding folks to enlist in our program for the unemployed. But if you're interested in supporting the organization, you can always go to facebook.com/becauseisaidiwould and start a fundraiser to help fuel our programs. all of this, though, is not as important in some ways as what we take as personal responsibility. We want to help and support different charitable efforts, but we have to model that behavior ourselves. We have to wash our hands, stay distant when we can, wear our masks properly, and change our Thanksgiving plans so that they are safer in the new conditions that we find ourselves in.
Yeah, and I think that's a message that really the state officials, local officials are really trying to hammer home in the last few days is rethink your Thanksgiving plans. And unless you can stay within the bubble of people that you currently are, really it might be time to consider canceling or drastically changing what you do for Thanksgiving. Well, Alex, I really appreciate you taking the time to speak to me. I know you are probably getting inquiries from all over the country from people, inquiring about this program. Is there anything else that you wanted to say or talk about to our viewers before you head out?
Giving up something like Thanksgiving, especially after all of this time, all the sacrifices that we have already made as Ohioans, is incredibly difficult. But we can look at it as an opportunity. To be honest, sometimes I'll attend Thanksgiving or something. I eat. I just kind of go through the routine. But if we use a virtual technology, just a video call like this, play a game, show pictures from back at home, get creative, and actually engage with your family members, right? That new medium kind of introduces us to an opportunity to do more at Thanksgiving than just sit next to each other on a couch. So I do think it's hard. It's a challenging moment to change our Thanksgiving plans, but we can see that as an opportunity to do fun and exciting things, do it differently, engage a little bit more. Because you kind of have to when you're on a video call. You can't just let it sit there. You got to do something. So what is that activity? I encourage Ohioans to get creative and do as much as you can to keep each other safe.
Thank you so much, Alex Sheen. That's great advice. And, I can't thank you enough for everything the organization is doing for the people of Northeast Ohio and for the entire country. I think it's a absolute inspiration. So with that, I will let you go, and thank you again for taking the time to speak to us. And stay safe, wash your hands, wear a mask, and do everything that you can to get our country through this last few months, through this last period.
We're gonna fight the good fight and go Bobcats.
I'll let that one go. All righty. Well, have a great night, and hopefully we can speak again soon under hopefully more optimistic circumstances.
Yes. Thank you.